I think there are three questions that come to my mind. There is a large consensus. AYUSH and LHTs have greater role to play than what governments have assumed them to play. The policy makers do make policies pronouncements, but they have not turned out to be actionable programs. Because 91 years back, the statement of integration was called for, and we are still talking about integration. So we can see the difficulty of mainstreaming a traditional Indian-based knowledge system to benefit the large number of people who are not able to get access to the health facilities. The third, I want to add that this legitimacy that we are talking about, which is not enjoyed by the local healers, is just the way the allopathy treats the Ayurveda doctors in that hospital that Madam has visited, or the meetings where one allopathy doctor will seem to be having a greater presence than the Ayurvedic doctor in the same hall. It is the same way the AYUSH doctors treat the local health practitioners. Since large number of years that I have spent in this field happens to be with the healers. I have related much less with Ayurveda doctors, but whenever we have related on this issue, there seems to be this, insecurity, let me put it. The Ayurveda people feel insecure. At least this is very clear in my interaction. So they feel threatened. And that goes without saying. Even in the last meeting which happened in the Department of AYUSH meeting about the relevance of a new pilot experiment that we are engaged currently in collaboration with the Indira Gandhi National Open University and the Quality Council of India to pilot a scheme for certification of prior learning for the healers. The space for healers has been lesser and lesser as we keep promoting Indian medicine. I think all of us need to keep in mind the current generation of healers are around 50 and above. In the next 20 years, there won't be anything local health traditions left if Government of India and the state governments do not wake up. So I'm sorry, madam. We as politicians, we as bureaucrats have not performed our duty. And it is failure of all the parties put together that we are still talking about integration of LHT, and the shift that I am seeing between the 11th and the 12th plan document. LHT has shrunk in its pace. I am indeed very shocked. I wish we have access to the bureaucrats who are managing the department today, and I request Vijay Bhai, who is not there, to make such engagement possible. Okay, very difficult to engage in dialogue. So the meeting that was held was witnessed, I think, only one person from outside the department. It resulted in a situation where all the three mainstream codified knowledge practitioners in the department saying this scheme should be stopped. Accreditation and certification of prior learning is a scheme that was promoted with a lot of hard work, and we felt that this will help in revitalizing a greater space and social legitimacy for the healer to be mainstreamed. And this was financially, and this is being financially supported by the department. So there is this insecurity feeling between the codified and the local health practitioners. So unless the health system perspective that Rituji spoke about, this will not happen. So there will be certified local health practitioner still sitting in a very limited presence in a big hall in front of an Ayurvedic doctor. So you can imagine these things will not change unless there is a mainstream engagement of policy and civil society As to how long should we take? Should we take another 90 years? That is my question. And I leave this question to be answered to engage in more such dialogues with the people who make decisions. And also I think in one of the meetings that we had in Sadar, it is a political process that has been very inefficient in our country. We have had Congress parties, BJP parties, Janata Dal parties, Janata parties, but this problem of Indian knowledge getting a bigger role, bigger significance to address the equitable access to primary health care has been a very faraway dream. So there is something wrong with all of us and with the political process, and this Sadat's initiative of bringing us together must begin to take more shapes. And I was telling Vijay Bhai about a month back that this must become not just an intellectual exercise. It must involve people. See, we didn't have JP's movement of political parties. It involved me and Vijay 40 years back. We were in the roads, we were shouting naras, and that's how there was that kind of a big political change. And it has not been happening in the last 20, 30 years in the way that it used to happen. And some of us must engage, bring the people to such a forum and have, I keep referring to him, people's manifesto on many of these things must be discussed by political parties. So I'm very happy we have one politician from Nepal. I think you see in Nepal a similar, experience. People have their own voice, and you as political parties have to listen to them and, keep aligning yourself to play a very effective role. I think it is time for us in India too to engage in this dialogue with more and more people joining this. Thank you very much for giving this opportunity. I was not mentally prepared. But this why part of the certification is what I want to end with. If we don't create the legitimate space for the healers to coexist, they are not interested to perform their role. And I asked many of them healers, why? Because they say, my own family doesn't respect my knowledge. What about the society? So it has gone down much, bigger and deeper malaise that the families which have nourished these local health traditions, which is the only tradition in the world, including in China, it doesn't exist. In China, this system of gunis don't exist. It is the only system of healthcare that is driven by the service spirit. Ayurveda doctor, allopathy doctor, they charge money to the patient even before they see the patient. Here is another contrasting example. Many of you might not see the healers in the field. They only ask about the problem and give the treatment. Sometimes they get paid. Sometimes there is only a gratitude, a sense of helplessness in the patient's inability to pay for the services that they have received. So there is a very alarming situation. In the next 20 years, make no mistake, there will be no local health traditions unless we wake up and strengthen through such innovative program like the why part that I mentioned. The certification of prior learning is one way that the state and the people of this country can enlarge the social legitimacy, the space for the healers, and there should be a serious attempt by the political as well as the bureaucratic and the intellectual exercise that must result in addressing many of these major gaps. Thank you.